Have you ever noticed the small rounded bumps on the cutting edges of your front teeth? Those are called mamelons. You might wonder, mamelons? What are those? Well, let's dive right in. Mamelons are these tiny, translucent bumps that can be found on the incisors. Those are the 4 teeth right in the front of your jaw. They typically appear in groups of 3, giving the edge of your teeth a slightly scalloped or wavy appearance. Especially noticeable on newly erupted teeth, you'll find them quite often on children's pearly whites. They may even be a slightly different color than the rest of the tooth. But don't worry, as time passes and with the normal wear and tear of chewing, these mamelons tend to smoothen out and become less noticeable. Now that we know what mamelons are, let's delve into how they form. Mamelons aren't just random bumps on your teeth, they have a specific formation process. These intriguing features start their journey before your teeth even break through the gums. Picture this. During the development of the teeth, 3 separate enamel lobes, akin to little builders, come together to form the incisal edge. This fusion of enamel lobes manifests as the scalloped or wavy edge we mentioned earlier, presenting the appearance of 3 small rounded bumps on the cutting edge of your incisors. This formation process is like a choreographed dance, everything happening in perfect time and order to create the unique feature that is the mamelon. Now, these bumps are most noticeable on newly erupted teeth, especially in children, and they may be slightly different in color than the rest of the tooth. So, we've learned about what mamelons are and how they form. But what purpose do they serve? While the function of mamelons is not entirely clear, we have some theories. Let's explore these, shall we? Some dental experts propose that these tiny bumps may have once played a role in our ancestors' eating habits. They suggest that mamelons could have helped with tearing and biting into food, much like serrated edges on a knife. Another potential function of mamelons relates to the eruption process of the teeth. The bumps might have served to pierce through the gums, making way for the new teeth to come in. This theory holds more weight when you consider that mamelons are most prominent on newly erupted teeth, especially in children. However, these are just theories, and the actual function of mamelons remains a mystery in the field of dentistry. Though their function isn't fully understood, there's no doubt that mamelons are a normal part of our teeth. But what does this mean for our dental health? Stay tuned as we delve into this in our next scene. Despite their somewhat mysterious nature, mamelons are generally considered harmless. They're a natural part of our teeth's development and are seen as a normal feature in dentistry. While they may look a little different, they don't pose any health risks or require any special treatment. So if you've noticed these small bumps on your or your child's teeth, there's no need to worry. That being said, we understand that aesthetics play a big role in how we feel about our smiles. For some, the slightly wavy or scalloped edge created by mamelons might not be their ideal look. If you're one of these people, there's good news. Dental professionals can carefully reshape the edges of the teeth to smooth out the appearance of mamelons. This simple procedure can help create a more uniform, straight-edged look if that's what you prefer. If you're not a fan of your mamelons, don't worry. A dentist can easily reshape your teeth. We've covered a lot about mamelons today, so let's recap. These intriguing features of our teeth, particularly the incisors, appear as small, rounded bumps. Formed by the fusion of 3 enamel lobes before the teeth break through the gums, they often show up in groups of 3, lending a unique scalloped edge to our teeth. Most noticeable on newly erupted teeth, especially in children, mamelons are typically small, translucent, and might even exhibit a slightly different color than the rest of the tooth. Over time, due to everyday chewing and general wear and tear, these tiny bumps smooth out and become less noticeable. While there's no definitive function for mamelons, theories suggest they might have once aided in tearing food or piercing through the gums during tooth eruption. Clinically, they pose no health risks and are considered a normal part of our teeth. Remember, mamelons are a normal part of our teeth. Whether you love them or hate them, they're just another fascinating facet of our bodies. Until next time, stay curious.